So your dog's coughing and you're wondering why. In today's video, I'm going to show you how a veterinarian goes about diagnosing a coughing dog. I'm going to go through the exact same steps with Tula. Then lastly, most importantly, I'm going to be sharing with you my top natural remedies. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Your dog can be coughing for a number of different reasons. It can be kennel cough. It can be a foreign body. There's a piece of wood or something in the airway. It can be a condition called tracheal collapse. It can be heart disease. It can be chronic bronchitis, also known as allergic airway disease. It could be heartworm disease. It could be the dog flu. It could even be pneumonia. But exactly how does a vet go about approaching a coughing dog? I'm going to use Tula as our little example dog. She actually has a history of a bit of a chronic cough. I'm going to go through the exact steps I would have done in veterinary practice where you come in, your dog's been coughing, and you're like, Doc, what is it? What can I do to help my dog? Here's what you can do. We started with the physical exam. Is your dog bright, alert, reactive? If Tula came in with a history of coughing, her head was down, she wasn't really making any eye contact, seemed pretty slow, and then I'd be concerned about something more serious, something chronic and ongoing, maybe a chronic bronchitis, maybe something infectious, like canine influenza, the dog flu, maybe even pneumonia. Whereas a dog that had something less serious, like acute onset of kennel cough, maybe tracheal collapse, they're still going to be BAR. They're going to come in, they're looking around. They seem pretty normal. Next, I'm going to be doing TPR. I'm going to take your dog's temperature, right? Rectal thermometer. If your dog has a fever, I'd be thinking of something infectious, like influenza, perhaps like pneumonia. Listening to the heart, and I'm feeling the heart rate. If the heart rate's pretty normal, once again, maybe something benign like tracheal collapse. The heart rate's up, potentially it's heart disease, maybe your dog has heartworm, maybe they have something infectious. Likewise, listening to the lungs, respiratory sounds, right? Am I hearing a decreased number of lung sounds? Could indicate fluid within the lungs. Hear crackling within the lungs itself, could be fluid within the primary airways. And that's something you can just go ahead. You can put your ear in the inside of your dog's, underneath their left armpit. You can hear your dog's heart. You can listen to their lungs, right? Putting right over top of your dog's chest. Have a little hear of the lung sound. Chris, I don't need to get you coughing any more than you need to. Oh, you're such an awesome little patient. No, you don't have a stethoscope, but you still do a simplified version of a basic physical exam. Obviously, using a stethoscope, I would listen to the heart to see if there's a heart murmur. And obviously then I'd be in big red alert. Maybe your dog has underlying heart disease. But in some of these dogs with large heart murmurs, you can actually feel it. Just putting your hands underneath their chest over top of the heart. You'll feel a swooshing sound signifying a murmur. Or you can put your ear over top of the chest. Sometimes you can actually hear a heart murmur. Check your dog's mucous membranes, their gums. So when you lift up your dog's lips, you look at the gums, they should be a healthy pink color like Tula has here. A dog that has something serious infectious that's compromising the lungs, compromising the amount of oxygen, these are going to be a bluish color. They're not going to be bright and pink. Next, you're going to put your finger over top of your dog's gums, count how long it takes for it to go back to a normal color. A dog that has, say, a serious infection, perhaps heart disease, they're going to have a delayed cap refill. Right? They don't have adequate blood pressure, and it's going to stay white much longer before the color returns to normal. Next, I'm going to ask key history questions to narrow down the cause. Is the coughing acute or chronic? Did it start all of a sudden, which makes me think maybe your dog just got exposed to another dog. Your dog has kennel cough. Versus something that's been chronic and ongoing, potentially getting worse. Something, maybe it's tracheal collapse. Maybe it's chronic bronchitis. Is it continuous throughout the day, or is it worse, for instance, say at night? First thing in the morning? For some of our dogs that have heart disease, that's what we see. I mean, the coughing gets much worse at night, especially when they get up first thing in the morning. Does exercise trigger it? And often what happens, a dog that has a collapsing airway when they're running, it's going to irritate the airway more often, they're going to be coughing more. Or they pull on their collar, right? What does that do? It compresses the airway, they start to cough. Then you're more thinking tracheal collapse is the cause. I also always want to know, has your dog been on any previous medications? How have they responded to these meds? So number one, if they're wearing a collar, take the collar off, right? If you're going to walk your dog, do it without a collar. Get him a harness, something so he's not putting pressure on his airway. And can you imagine as he pulls that collar, just try it on yourself. You feel like coughing. So you imagine every time he pulls, he's got an irritated airway. Get rid of the collar. God, I can't even speak well after doing that. No wonder our dogs cough so much. Yeah, so no collar. Number two, increase the humidity in the air. For virtually every underlying cause of coughing, if you add in additional moisture, that is going to decrease inflammation in the airway. It also actually makes it easier for your dog to then take in more oxygen. Now, for instance, for people, when they're actually suffering from really chronic, ongoing compromised lungs, they're actually warming up that air and they're adding in moisture to it. Actually helps them to absorb more of that oxygen. So no, it's not just some old wives' tale. It really is a thing. You want to add in moisture, and if you can add in a bit of heat to that moisture, even better. Get a humidifier. Number three, an awesome anti-cough remedy. It's great for dogs that have kennel cough, bronchitis, even tracheal collapse. The awesome anti-cough remedy, honey, that we're starting with, it soothes the airway, anti-inflammatory, great for chronic bronchitis, tracheal collapse, antibacterial, antiviral, great for dogs that have kennel cough. It also includes green tea, anti-inflammatory, antibacterial, antiviral. Last but not least, we have lemon. It's got a great antioxidant, been shown to be really beneficial for many of our dogs that have kennel cough. Starting with green tea, this is 1/2 a cup. I would let it sit, steep, and cool for about 15 minutes. Next, our unpasteurized local honey. I'm putting in 1 tablespoon. Third part of our recipe, this is 1/2 a lemon. I'm going to put in 1 teaspoon of freshly squeezed lemon juice. There's the teaspoon, Poodle. Mix it well together. We're looking at doses of 1 teaspoon per 10 pounds of body weight. And that can be given 4 times a day for an acute coughing dog, like a dog that has kennel cough, or you're going to be giving that twice a day for a dog that has an ongoing cough, like tracheal collapse. And it tastes pretty good. Number 4, and I've used this a lot for many of our dogs that have coughing, this is dandelion. This is a dandelion tincture, and it includes a large part of the leaf as an extract. And that's what's important. So the dandelion leaves themselves are probably the best herbal diuretic. So what we're wanting to do is take away some of that excess fluid. So if you have a dog that has underlying heart disease, this can be beneficial. You have a dog that has underlying chronic bronchitis. He's got all this airway inflammation, got secondary fluid within the airways themselves. This dandelion can really help remove some of that fluid. And I'm finding for the majority of dogs that are coughing for whatever reason, dandelion often really helps. A standard dandelion dog dose, it is about 1/4 ml of the tincture, which you can see here, that's per 10 pounds of body weight. We're giving that 2 to 3 times a day. Then last but not least, an anti-inflammatory that can benefit most dogs that are coughing. The non-psychoactive portion from the cannabis plant, cannabidiol, also known as CBD. Regardless of the underlying cause, your dog is coughing, and every time he coughs, he irritates his airway. He's got airway inflammation, whether it's heart disease, whether it's chronic bronchitis, whether it's kennel cough, whether it's tracheal collapse. So this anti-inflammatory, the cannabidiol, can naturally decrease a whole bunch of that inflammation, maybe slightly sedate him so he feels a little bit better. He's not quite so anxious from the coughing. And it's safe to give our dogs. We're not dealing with any serious secondary side effects. And if Tula's ever had this kind of ongoing coughing outbreak, say she pulled too hard on the collar, for instance, which you probably shouldn't be on, I've given her CBD and it's really helped. A standard CBD dose is 3 milligrams per 10 pounds of body weight. I was just giving that twice daily. So that would equate to 1 drop of our tincture per 10 pounds of body weight twice a day. So if you happen to have a coughing dog, especially it's ongoing or just all of a sudden happened, I encourage you to go through the steps that I've gone through. I mean, that's what would happen if you had brought your dog into the veterinary practice when I was working there. I would go through those steps. I'd watch your dog when he came in. Is he BAR? I would do a complete physical exam, including a TPR, including listening to the lung sounds, including listening to the heart. I'd ask you questions about history. I'd ask you questions about medication. So go through all of that yourself with your own dog. You're going to have a pretty good idea then likely what's going on with your dog. And then if it fits, try one of those home remedies. Then obviously if your dog is clinically ill, he's really sick, it's ongoing, it's getting worse, please go in and see your veterinarian. But at least you now know sort of what they should be doing, kind of their thought processes, and just make sure they go through all those steps as well. Thanks again so much for watching this edition of Veterinary Secrets of why your dog is coughing, most importantly, what you can do about it. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.